Our next phase with Joey is going to be a little touch in his anteromedial cheek. As you know, the masculinized cheek isn't going to be as much high lateral cheekbone, but it is anteromedial or the mid position of the cheek. So I look at cheeks in two positions. You have the medial cheek, which is going to be when Joey smiles. That's kind of the apple of the cheek. And then when he relaxes, it's all about that zygoma. How are we lifting that? Are we creating that Nike swoosh? And how are we lifting and making this a beautiful, more snatched look, probably for more of a feminized look than a masculine look. So with Joey's masculinity, we're going to just help support the mid-face, help support that apple of the cheek without feminize his features too much, as he already has a great structure and arch to his cheek. So let's show you how it's done. All right, let's do it. So let me mark you. And then I just want to make sure we can reach this. There we go. So we're going to do that. I'm going to literally blend just like a 0.1 there, but then go more anteromedial. All right, and then same here. Perfect. There. Mark out those borders. That's perfect. Okay. All right. Do you need any ice, Joey, or are you okay? Perfect. All right. So we're going to do one big poke. This is a cannula technique. It's a beautiful way to kind of take the paintbrush under the skin and paint and contour those areas of volume loss and just a very natural balanced look. I love cannula for the simple fact that it keeps it safe, but it keeps it beautifully distributed in the natural look that Joey desires to make this beautiful natural cheek. So let's do a little touch right here and on 3 and 1, 2, 3 and poke. Sorry, Joey, no. And there we go. Beautiful. That is just going to give us, that is the pilot that is going to introduce the cannula. As you guys know, cannula is a blunt tip needle. It's a very safe and comfortable way to do things, but we got to introduce that cannula some way, right? So we're going to give one little poke to the skin. And then what we do is I'm going to come back on the high lateral cheek. Once again, as I said before, I'm not trying to build a high feminized cheekbone on Joey, but I do want to help support the structure. This will give him a little support high lateral, so we can pull the cheek up to keep that natural look that he already has. So, and then we're going to then turn anteromedial and just pick that up in the mid-face. So just a little blending. This is a fairly comfortable injection technique. There's lidocaine mixed in with the product. We are actually just going to split one syringe of Voluma on Joey, 0.5 left, 0.5 to right, and just kind of balance that anteromedial mid-cheek to the lateral cheek as well. And like I said, even though this seems aggressive, this is a really soft, comfortable approach for Joey to keep just the balance. And this is where we're going to address that little nasojugal groove slightly. And just plump that up a little bit, and the mid-face. We got about 0.2 left. Beautiful. I also will support his under eyes slightly, even though he doesn't have any under eyes problems. We're going to support that lower cheek ligament or lower eyelid ligament to support the volume. Just a little on the apex and last pass. Just to pick that up and beautiful. Great job, Joey. Okay, that side's done. What do you think? Not too bad, right?
Honestly, you don't really feel that much.
Good.
Like, it doesn't hurt. It
Good.
just feels weird.
Perfect. I know. It's a different feel for sure. For sure. Okay. Let me come to this side and actually, you know what? Let me do this to poke. And 1, 2, 3, and poke. There we go. That's perfect. And you, Joy, I will do a touch on that side and then I'll come across you. Okay. So once again, as I'm right-handed, we're going to enter this side just to kind of pick up just a little bit in the mid-face and then the lateral cheek. So as you can tell, we're kind of going anteromedial, plumping up that fat pad deep to superficial. There we go. How are we hanging in there? Doing okay?
This is my good side. I don't feel anything. Yeah.
I know this can sometimes zing, so once again, I'm going to support that lower lid, mid-face, and anteromedial cheek. And then, of course, we're going to pick up the apex of that cheek, utilizing the cannula so it keeps it very comfortable for Joey. Beautiful. And then I'm going to come to the other side so we can reach Joey's lateral cheek. So if you turn my way lightly, Joey, we're going to enter the same port, and we're just going to go just a touch on his high cheek now. So you can kind of see that cannula moving a little bit. This is where we're just going to lay a soft layer to help pick him up and keep the balance on those cheeks while keeping a very masculinized look that Joey appreciates. While also supporting the area. Sorry, I got a little. There we go. All right. So the biggest question I get asked is, I don't want to look unnatural. Now, hyaluronic acid is a very natural approach. The problem we go wrong with when we inject the wrong thing the wrong way is we overfill areas. I am here to enhance tissue plane and not here to make tissue plane. So when we lightly enhance a cheek, enhance a lip, temple, chin, jawline, any of that above, we just want to enhance and support the tissue plane to hydrate it, to create the supportive measures with volume loss, age-related changes. So filler is here to help support and not change. And that's the misconception with most of these hyaluronic acid profiles is we want to support, hydrate, and balance on a very beautiful natural level.